Can you just give us a breakdown of the risks and benefits of the two types of biopsies, just so our listeners understand if they have the opportunity to at least make a choice between the two?
So the reason why there's a push to move away from transrectal biopsies is that, as you can imagine, this needle is going through the rectal wall. So that needle gets contaminated by stool in the process, or bacteria that's in the colon. As the needle passes through, it can take bacteria with it and then introduce it into the bloodstream. So there's a risk of pretty bad infections with a transrectal biopsy, with around 4 to 5% of people actually getting hospitalized after a prostate biopsy with an infection. And these infections are usually so bad that they need IV antibiotics. These infections occasionally will be so severe that people can die. So there is a documented 0.5% chance of dying from a prostate biopsy when a transrectal approach. And that's why people started moving out of the rectum and doing the biopsies through the skin. And so these transperineal prostate biopsies have a much lower risk of infection. That risk is 0.5%. And the severity of the infections is usually much less.